got thyroid, then what? Endocrine? Semi-endocrine.
Also, people would think, wow, CT scan must be advanced. Wow, MRI even more advanced. Not true, you know. For thyroid, we go back to basic. Right buttock looks 3 times the size of his left buttock.
Oh my goodness.
We thought it's a tumor.
Go and check and see Dr. Tan Wee Boon. Welcome back to
Dr. Horh.
Hey doctor, what is it doing here?
This is called thyroid glands.
Oh, I remember you telling me you had a patient just recently, is it?
Yes, I often see thyroid nodule because I do a lot of MRI spine.
Oh, then why you bring here today for what?
We need to educate our viewers about thyroid glands.
Yes, correct. Actually, in fact, let's call Dr. Tan Wee Boon. He knows it very well,
You
right?
know him?
Yeah, I know him. He's actually my friend's uncle.
Oh.
Yeah.
Okay.
Yes.
Then should we call him?
Let's call him.
Yes.
Let's call Dr. Tan Wee Boon. Let's
Okay.
roll it. Whoa, this is Dr. Tan Wee Boon, right? Dr. Tan WB. Good to see you, doctor. Good to have you. This is the doctor that specializes in lumps and bumps, right?
Yeah. What's the problem?
What's the problem? No, well, the problem is today we have him here with us to speak
Alright.
about lumps and bumps. Okay. Yeah.
2 years ago,
Uh-huh.
I posted one video on lipoma. It's a lump.
Oh.
Then
oh.
it went viral.
I think I saw that.
Hey, I remember that video.
saw that?
Yeah.
Yeah.
I sent it to my family and friends. It was very informative, eh?
Yes.
Yeah, you remember the video, right?
Yeah.
Of course, you posted it, man.
Then, this is the first video that went viral. But do you understand? It was in Indonesian.
I understand just the first minute only.
Ah.
Yeah, and after I didn't understand.
I think we should get somebody more expert
Expert.
talk about it in English.
Right, that's why we got a Singaporean
Yes.
lump and bump.
Especially.
Yes, correct. Hi,
Correct.
Dr. Tan.
Hi, nice to meet you all. Thanks
Yes.
for having me here. I'm Wee Boon. I'm a general surgeon. Lumps and bumps is one of my specialty. You're right to say that.
Yes.
Yes, that's
But
right.
what is your subspecialty?
I do thyroid surgery as well. So I do surgeries on thyroid, mostly the necks.
Why do you choose endocrine surgery?
Wow, that has to bring me back to my medical school time. I was quite inspired by more of the senior that I came across during my training.
Okay.
Who's an endocrine surgeon, who really inspired me to go down this specialty.
Okay, actually, when you talk about lumps and bumps, then got thyroid, then what? Endocrine? Semi-endocrine? What is endocrine?
Okay, endocrinology refers to the system whereby the organs in our body that produces hormones. So any organs that produces hormone is considered endocrine organ, such as thyroid, parathyroid, pancreas. These are all endocrine organs. So I deal with surgery related to all these organs.
Oh.
So all of us have a thyroid gland, male, female. Though most people would think that only female has thyroid gland, but it's not true. Everyone has a thyroid gland. The 3 of us have one each, hopefully.
I don't even know that I have thyroid glands. Now I know.
You know where?
I don't know where.
But you know where is it?
Where is it?
Joshua?
In Orchard Road?
You make a guess. Which part of your body is the thyroid located?
I think definitely somewhere in my body lah, but I don't know where.
Huh?
My neck?
Yeah, you're right.
My
It's a
neck?
very basic
Oh, okay.
But it shouldn't be seen or felt in normal situations.
So I
if
can't
you
feel
can
my
feel or
thyroid.
see your thyroid, then something is not right. You
Wow.
should come and see me.
Actually, I do a lot of MRI spine, and I often saw nodule in the thyroid picked up in the MRI spine.
That's right.
And most of the time, the patient doesn't feel anything in the neck.
That's right.
So when should I refer to general surgeon like you?
Okay. So these are what we call incidental lomas.
Yes.
That means they are picked up incidentally. That means patient has no such problem, but because they go for a scan, be it ultrasound, MRI, CT scan, they see something that was not meant to be seen, to put it that way. That means I'm not looking out for this problem, but because it's part of the scan.
And then it just happened that
scope,
always
and then
there,
there's something there.
right?
Yeah, so it's not uncommon to
Okay.
pick up such
Okay.
lesions because we are just doing more and more scans nowadays.
Yeah,
Everybody has a scan done. Have you had any
Yes.
scan done on
I
yourself?
scan my product at fair price. That's the only scan that I did so far.
So everybody go for full body scan. Then things get picked up incidentally. So we call this incidentaloma. As for who needs to be seen, like what Tony is asking, I think if it's picked up, you should have at least get a specialist to check it at least once. Any growth, because any all these incidentalomas are basically their growth in the body. With any growth, our main concern is cancer, correct? Anybody when there's a growth in our body, our main worry, is it cancer? Is it cancer? Is it cancer? So that's the main thing we need to address.
I see.
So can I just ask? Nodules in the thyroid is very common, right?
It's very common.
What is the proportion of those nodules in the thyroid that are serious?
Yeah. For example, if I bring an ultrasound machine to the MRT station,
Okay.
I make 100 women who walk past me do an ultrasound, regardless whether they have a lump and whether they feel anything or not. Hey, stop.
okay.
Let me just
Ultrasound
your neck.
Okay.
Studies have shown up to 50-60% of them will have some nodules in their body, in the neck, in the thyroid.
Why must be women who get stopped?
It's a thyroid problem. It's more happen in women. Maybe 80-90% of my patients are women. It does happen in men too, but more commonly in women. Like I said, we have our own problems. They have their own problems. So more thyroid problems are found, or more women have thyroid problem than men.
But what is the proportion of the thyroid nodules
Being cancerous?
Yes, cancerous.
Thankfully, 90% of them are not cancerous. They are just part of aging process. It tends to happen in women above the age of 50 as we get older. It's like wear and tear, degeneration. As we get older, our bodies start to grow things,
So
but most of them are not cancerous.
So means those things so the thyroid is like an organ, is it?
So Joshua, so this is our thyroid. So it like I say, it sits on the trachea, the windpipe.
This is the windpipe.
Like
This is
a
the windpipe.
butterfly.
Yeah, so this is a butterfly, like a
Butterfly
butterfly-shaped organ.
Okay. What's this?
This also is just this model just show various enlargements. So when an enlarged thyroid, it looks like this, when it's big.
Okay.
So these are multinodular goiter. That means this thyroid has lots of nodules.
Right.
Is it cancerous?
That's what we're trying to find out. We have to do ultrasound and biopsy to find out.
Right,
Then this
I
model
see.
show, which is more common, which is just one single growth.
Just one tiny
One-
growth
If
there.
you have growth like that, can you feel it?
So if like this model, if it's on the
this big.
surface, you should be able to see it. But if it's deeper in, then you can't feel or see it. If it's behind. So if it's growing, so for example, I have a patient with 3 to 4 cm size growth, but from outside, can't see, can't feel, because it's growing inwards.
Right, I
It's
see,
going
I see.
from this part inwards.
I see.
Not from the outer part.
There is no specific cause as to. So means if you're just unlucky, then they just.
Well, I won't call it unlucky. It's just part of life, part of aging.
I see. I mean, like it can turn into a problem, right?
Yes, definitely. It certainly can turn into a problem.
There's a problem. My doctor, there is a problem. Yeah, there is a
So
problem.
it certainly can be a problem. So that's why our job is to detect it and make sure this nodule is nothing of concern. That means it's not something cancerous, before we decide what to do with it. So we usually will
see.
get a scan and then a biopsy. Like what Tony has a patient
I see.
last week. He picked up a growth in the thyroid on the MRI. That's why he sent over.
So do you biopsy everybody with thyroid nodules?
Good question, Tony. But no. So the best scan again. A lot of people think that CT scan, MRI, is the best. Best scan. If you ask people who are they will hear once you hear MRI, CT scan must be good, must be accurate. But to see thyroid, actually CT scan, MRI are not good for seeing thyroid. The best scan for seeing thyroid is actually an ultrasound. Surprisingly, people would think that
The one that show the baby one.
show baby one. Yeah. Also, people would think, CT scan must be advanced. MRI even more advanced. Not true, For thyroid, we go back to basic. So
I see.
ultrasound is the best way to look at the.
So when do
MRI.
you do biopsy for
Okay.
nodule?
So it depends on the ultrasound findings actually.
Okay.
Like the case that the patient you send over, on the MRI it says 9 millimeter. Then when they do the ultrasound, it's actually 1.3 cm by 1.7 cm. So because MRI and CT scan don't characterize thyroid that well. So the ultrasound will tell us how big, how suspicious it looks inside. Then we decide whether do we need to biopsy them, meaning putting a needle in to take some cells out. Sounds scary, but it's always nothing dangerous, nothing harmful. Can be done in the clinic, 5 minutes, and you can go home on the same day.
I see.
So it's nothing dangerous. But like what Tony asked, only the big ones, the suspicious looking ones, then we do biopsy.
So what's the main treatment here that we have for this thyroid issues? Yeah.
So the treatment will really depend whether this thing is cancerous or not. Thyroid cancer. Unfortunately, there's only surgeries that can be done. Not like other cancer like colon cancer, lung cancer, leukemia, whereby chemotherapy sometimes or other treatment. But for thyroid cancer, it's surgery, removing the thyroid gland.
I see. Move the whole thing.
In general, sometimes we don't just remove the lump. We either have to remove half, or we take out the whole thing.
We take out the whole thing.
Sometimes people are obese.
Neck
is big. How do you know if it is obesity, fat, or something to worry?
Some friends, they walk like with no neck on. Why?
Those can be hard to tell whether there's any swelling. So I must say that can be difficult.
But sometimes you don't have cancerous nodule, but just the thyroid become big.
That's a goiter. A goiter just means enlargement of the thyroid. In general, for various reasons. Last time, in the past, there's iodine deficiency in the food. So the thyroid responds by getting bigger. But nowadays, we have iodinized salt. So iodine deficiency is not a problem. We don't see goiter, diffuse goiter anymore.
I see.
We still do see some diffuse neck swelling. That means the whole gland becomes swollen. In other conditions, such as Graves' disease. Graves' disease is... Do you remember your medicine, Tony?
Graves'
disease sounds familiar. The eyes very big.
Graves' disease?
Yeah, the patient... Graves. The patient very anxious, shaking, tremor, very bad temper. I have patients who say that how they found out they have Graves' disease is that they keep scolding their husband until the husband cannot take it.
Then like that,
a sudden change in temperament, a sudden change in temper.
That's because of
the Graves' disease, the disease
thyroid
itself.
problem.
Yeah, the thyroid hormone too much.
Wow, that means
then they become very agitated,
so
very anxious.
I must tell my girlfriend.
Disturbing the husband so much.
Ask her to check her thyroid hormone.
Ask her, hey, go and check and see Dr. Tan Wee Boon.
Check the thyroid hormone.
Correct. It will solve the problem already.
If it's from the thyroid, then yes. But if it's not, then send it back to you.
Send it back to me. I'll do the checking.
You check.
Oh, walao eh. My goodness. Hey, but anyways, so actually, right, correct? So means that let's say now there's a nodule inside the thyroid, right? So there's a swelling. So when the thyroid swell, it will manifest as a swelling through the neck.
Yes, very good point. Yeah, and neck is such a confined space with many essential important things. The two most important things that's going in through the neck is our food pipe, our esophagus, and more importantly, even though you think food is important, what's more important than food?
What?
Air. You cannot live without air. Correct. You can live without food for a few days. Get your priorities.
Cannot live without air for a minute.
I feel roasted right now.
I know you're a foodie, but air is more important than food, Joshua. So it's the food pipe here. Windpipe.
The gullet. There's a gullet and a windpipe.
Windpipe and the food pipe.
They share the same space, is it?
They share the same space in the neck. So any growth in the neck actually can compromise the space. So patient may have problem with swallowing because food gets stuck. Or worse still, breathing. If it really, imagine something strangling your neck. So those are of course worrying. But usually patient won't wait until so symptomatic before coming. Most of them will come with
the neck will just like gets bigger as the thyroid.
That part of the neck.
The part of the neck will just get bigger.
Right. Not the whole.
And so they can feel that lump there. It's like coming out
something
of that thing. Oh, I see. So
And if they look carefully, if they swallow, the lump moves with swallowing. That's usually how we tell that the lump is from the thyroid. If it moves up on swallowing.
I see. So it means it will move together with the food movement.
Moves up with swallowing.
That's right.
Classic. That's interesting.
Is there any lump in the neck that does not move up?
Those that attach to the skin, they are not from the thyroid, it will move with swallowing. Lipomas, sebaceous cysts, lymph nodes, they will move with swallowing. Only thyroid gland moves with swallowing.
Right.
So if you see a lump in the neck, just by looking, can you tell whether it is dangerous or not? Cancerous or not?
In a way, of course, anything that's big is dangerous.
Anything that's big is dangerous.
Is big.
Yeah, so
Goiter
anything that's big,
is
because you are worried about size. Size matter, Size does matter.
Your size matters.
Yeah. So in general, in thyroid, we say anything more than 4 cm is worrying. So we use a cutoff of 4 cm.
By the way, what is the size of your thyroid? Thyroid.
Thyroid gland shouldn't be able to feel or see. The general size is a butterfly-shaped organ. Later, I'll bring the model. It should be about 5 cm in length.
Okay.
Each lobe is measuring about 5 by 3 by 2.
So everyone should have the same size.
Almost, yeah, normal. Everyone should have the same size.
But you say if it is more than 4 is...
The nodule, the growth.
The nodules.
If the growth itself is more than 4 cm, then it's
I see. So it means that, but lumps and bumps itself, right? We're talking about lumps and bumps. It occurs throughout your whole body.
Yes, it can happen any part of our body, from the scalp, from the head to the toe, basically. Scalp, face, neck.
Okay.
So in the neck,
chest.
you don't just get thyroid lump, but you get other thing as well.
Yes, usually when I see a patient with a neck lump, the most important, how I, dichotomize them will be, is it from thyroid or not thyroid? And the easy way is to ask them to swallow. If this thing moves with swallowing, then it's a thyroid problem. Then I focus on the thyroid. If this thing doesn't move with swallowing, then it's this lump comes from some other place.
What do you feed them to swallow? You feed them a burger to swallow?
No, burger is too expensive.
Not too expensive.
Just water.
Just water.
That's enough.
Yeah, I don't have so many burgers in my clinic. I'll be broke before that. All patient needs to go to a cardiologist already. All my patients eat burger.
Too much burger.
Oh, yeah, true, right, that's right.
What is the most common lumps and bumps that you see?
Yeah.
Not from thyroid. If it's not from thyroid, most common occurring lumps and bumps are lipomas, and that's why Tony's video go viral, and then sebaceous cysts and lymph nodes. Lymph nodes are another common. These 3 are the common ones that we usually see
Okay, so I think we can ask you about sebaceous cysts. Right, what are those sebaceous cysts?
Sebaceous cysts, again, all these sebaceous is actually a normal arises from sebaceous gland. These are oil producing gland that's found on our skin.
Okay.
So they get block, overproduce this material, which is sebum.
Okay.
They get a bit of abrasion.
Okay.
They start to form a cyst on the skin. It looks like pimple, sometimes with a black dot in the middle.
Like a blackhead.
Like a blackhead, but bigger. Most of them are bigger.
Okay.
What's that blackhead actually?
Blackhead is just skin pigments, I think.
Okay.
But if it become much bigger and there's a lump, then that's when it becomes a cyst. A cyst has a wall. It must have a wall to call a cyst.
I see.
It must have a bag.
Right.
So that's why it becomes a lump, because there's a wall and there's a material inside.
Right.
Please don't squeeze.
Don't
squeeze anything.
Do not squeeze
it. Yeah, because by squeezing it, you're actually you're causing an abrasion on your skin, and then bacteria gets in, and then you get infection. So don't squeeze. You will never be able to squeeze it out. You can squeeze the material out, but the wall, remember the wall is still there. Show I can squeeze out the sweet. The squeeze out already. But this thing is not. It remains inside you. Then you'll form another sweet.
Oh, you can produce another one.
No matter how many times you squeeze out, because the wrapper is still inside, you'll come back. You'll recur again. So no point squeezing.
That was a lot of information. We will take a break for a moment, and we'll come back with better things to you. All right, welcome back to Dr. Sewan Horh. All right, so we're talking about sebaceous cysts, right? Actually, what causes sebaceous cysts?
Yeah, it's nobody knows actually. To be honest, it's the etiology is not related to food, not related to activity. So it sort of just happened, just like a lot of the, lumps in our body, unfortunately.
Okay.
It's not dangerous. They are not cancerous. Also, there's one big good news. I always tell my
Okay.
patient, if you have a sebaceous, it's not cancerous.
Okay.
The two problems it can cause is, number one, of course, in certain areas it may be visible, doesn't look nice, may affect some function. The other problem that is more troublesome is that it can cause infection. Then it become an abscess. Have you seen those videos whereby, like, they have patient have a big pimple either on some part of the body and you squeeze out. They like to show video of the process of
They
squeezing.
love to show those
It's so
satisfying videos.
Yes,
Yeah,
yes,
but
it's so satisfying.
check out this worm, the big worm, that. Yeah.
Wow, worm, then there's a different story already.
So it means that sebaceous cyst is harmless.
It's harmless except that it can cause infection. Then that will be very troublesome. If it's red, swollen, painful, there's probably some infection going on. So the patient should see a doctor. If it's indeed an infected cyst, then the doctor usually can start some antibiotics if it's mild infection. Typically if it's something, if the doctor feel that there's pus inside and it's more than what the antibiotics can manage, then he will refer you to he or she will refer you to a specialist like me to get the infection treated. Then at that time we need to let the pus come out, but not by squeezing. We make a big cut so that there's a hole, there's a lobang for the hole for the pus to come out, and we can wash.
Okay.
Keep it clean.
Do you need to remove the wall or just let it out, let the pus
During
out?
the time of infection, I usually typically tell my patient, we just treat the infection first. Because to remove the whole cyst at that time is too big. Because at the time the infected cyst is swollen, it's big. It doesn't make sense to make a big cut just to remove it. At that time, we just need to make a small cut, let the pus come out. Once the infection settles, it shrinks back to normal size. If it's still there, we can then do a smaller surgery to remove the remaining cyst.
Then that will leave behind a scar, right?
Yeah, unfortunately, any surgery would leave
I
behind some
see, I
form
see, I
of
see.
scar.
And some more, if it is infection, the scar,
Scar may
usually
be-
is very bad.
Yeah, scar may be bad. So if this, so the hole will be open. We will stuff dressing inside to keep it open, and then there will be a gap. And then every couple of days, the patient to have the dressing change. It's a bit troublesome once there's infection.
I see. So it means so how do you avoid infection for sebaceous cyst?
Number one, don't squeeze it. Remember, I said don't squeeze
number
it.
one,
Leave it
don't
alone.
squeeze
Yeah,
it.
leave it alone. Don't touch it. And if it's growing, getting bigger, disturb you, quickly see someone. So a general rule for any lumps on our body, if it's growing in size, especially if it gets more than 5 centimeter, if it's starting to have other symptoms that is besides the fact that you can see one, start to get severe pain, numbness, or there's bleeding, then quickly get it checked up.
What is the biggest lump or bumps that you ever remove?
Well, I
Yeah.
remember one uncle has his buttock lump,
On the butt.
on the buttock.
Oh.
It almost, his right buttock looks 3 times the size of his left buttock.
Oh my goodness.
We thought it's a tumor,
Okay.
but in the end, after removing it and after they sent for biopsy, it's just a sebaceous cyst.
This is this.
And you mean it's that big?
Yeah, I don't know how he can, wait until so long. He must have problem sitting.
Yeah. I mean, like, it means you sit on your cyst every day.
Yeah, possible.
Oh
I think
my
that's what he's been
goodness.
doing. But sometimes old people, they like to wait, before really see a doctor.
Infected or not infected?
Thankfully, no infection at that time still.
So less painful, that's why you can bear
maybe,
with it until it's so big.
And then they, there's some patients just don't like to see doctors, especially like what Tony said. If there's not causing them problem, then they will just leave it.
What about thyroid lumps? What is the biggest that you ever removed?
Oh, thyroid lump biggest will be, really can, again, I show you the picture next time. Really can see that there's a whole swelling just protruding out this way. Yeah, those are big surgery because we are very worried about, whether the patient can breathe or not during the surgery.
I see. But is there like a risk of like the patient dying if you go through that surgery?
Thyroid surgery in general, very few mortality in the sense that very few people die from thyroid surgery.
Okay.
Unlike, let's say, lung surgery, liver surgery, heart bypass surgery. Where even those low, in general, death during elective surgery are low. They should be less than 0.1%, but they do occur, especially you're operating on vital organs such as the heart but the thyroid surgery, usually nobody pass away from a thyroid surgery. The only danger is if your hormones are not controlled properly before the thyroid surgery, it can be dangerous. So we always have to make sure your thyroid hormones are normal before going for any surgery, for example.
Go back to the big thyroid lump that you remove. What's the cause?
In the end, thankfully, it's not cancerous. It's again a benign, non-cancerous growth, but it just takes a very long time for it to grow to that stage, and this patient just refused to come to see a doctor.
Okay, but like what can cause the so-called like thyroid lumps or nodules, right, happening inside your thyroid?
Okay.
Like, what can cause that?
The most worrying, of course, is cancer. Then again, the non-cancerous one also don't have a very specific reason unless there's some genetic problems that you have that then predispose you to having thyroid cancer, for example. If not, rare now for iodine patient to have not enough iodine, then the neck will be swollen.
I see. But means that what kind of like predisposition are we talking about here?
Patient with exposure to radiation before.
Radiation.
Big nuclear accident, let's say Chernobyl or the recent
World War
Fukushima. World War II. World War II is a bit
too far away. But no nuclear possible. The nuclear event.
Okay. So all this and radiation do predispose thyroid cancer. So I have colleagues, actually orthopedic surgeon, they wear a lead shield. Does Tony wear a lead shield when you do
when I use X-ray, then
you use a thyroid shield.
You need to protect the thyroid, otherwise the thyroid gets shine and become cancerous.
Actually, Tony or orthopedic people, they wear a lead gown to protect their body from repeated X-ray. 1 or 2 X-ray is safe, so don't worry about getting X-ray.
Okay.
If your doctor say you need X-ray, go for it. We are not scaring. Later they get scared. Dr. Tony, Dr. Tan cannot go for X-ray. 1 or 2 X-ray is fine. It's just that Tony or his colleagues, they do 10,000 such cases and they're just every day exposed to X-ray.
They have to protect themselves. Yes. So actually, I mean, just for our viewers to understand and to take home, right? Give a summary of whatever you just spoken about. Thyroid. Thyroid. Yeah.
So in summary, if you have any lumps in your body, that's getting bigger, causing problems, do see a doctor. We will do a quick examination, order some scans, do a biopsy if necessary, because early intervention will make a difference in the outcome, especially if it's something cancerous.
So remember to like, share and subscribe to see more videos like this. We will bring you more and more great content, so stay tuned. Dr. Tony?
We will give you more and more reliable and trustworthy information that are useful to all of you.
That's right. And doctors, we say it together. Dr. Say One Horh.
What's the problem?
Okay.